I'm Heather Mroz from Fort Lauderdale, Florida. My husband and I had one beautiful child who is running around and cheerful and happy and the greatest thing on the earth, so we figured we would have another child. We found out we were having twins. We were happy, we were excited we were having two. We weren't worried about our jobs, we weren't worried about anything. Everything was stable. As the time passed, my husband's company went bankrupt, and we got a little shaky grounds there, trying to figure out what to do. We had health insurance. I called the insurance company, and we ended up getting emails from his company's HR department stating that everything's fine, we're going to be covered. I was 20 weeks pregnant, and we had some complications, and I stayed in the hospital for 6 weeks. We had letters from the insurance company to the hospital saying that we've paid our premiums, everything's okay. Finally, we had the birth of the twins. They went to their third doctor's appointment, and the doctor's office told me, sorry, your insurance is canceled. And I kind of looked at him funny. I'm like, you need to run that again. Are you sure you have the right number in? Are you sure you have the right name? I called the insurance company, and it was just a vicious cycle of getting hung up on. They didn't know what was happening to us. We had no letters from them saying that they were dropping our coverage, no emails, no communication. So we thought we had insurance, and we didn't. I finally started adding up the numbers, and we owed over $482,000 to all of my providers. And when that number hit, it was just like hitting a brick wall.
In a case like Heather's, unfortunately it happens all the time. Big insurance companies are complex and vast bureaucracies, and every employee of a big insurance company knows that he or she has to play some role in making sure that the company meets its profit expectations. What companies do to maximize their profits, they have several different ways to do it. One is by rescinding policies when someone gets sick.
They told me that our insurance was canceled because we didn't negotiate premiums before the babies were born, which was false. I kept in constant contact with them, even the hospital. They knew the babies were coming. They knew exactly what was going on.
These are common delay tactics because the insurance companies know that if they drag these things out, a lot of people just will accept a denial, thinking that they have no recourse. As an insurance company executive, I felt often very insulated and isolated from the real world. I didn't have a chance to really see people suffering and the real consequences of people who are denied coverage or lose their coverage. When people lose their coverage, it's not just one person who suffers. It often is an entire family.
It really devastated me and put all of us into a depression and all of us into a bind. We can't rent a property, we can't get a cell phone. My husband can't get a job because they do credit checks, and if you owe an extreme amount, then they won't trust you. So here we sit in my mother and father-in-law's house, bankrupt, constantly trying to figure out what to do from here. As for the future of our kids, who knows?
Health insurance reform means that you're going to be able to get what you pay for if you have health insurance, and we're going to stop the insurance companies being able to drop you if you get sick, being able to limit the care that you can get. We're going to make sure that people aren't barred from insurance coverage because they have what's called a pre-existing condition.
This reform legislation will help families like the Mrozes. It will, at long last, make these companies more accountable to consumers and not just to shareholders.
We want everyone to have the opportunity to find affordable health insurance, and that's what this is all about.